Welcome to this edition of our live program, Let's Talk Health Cardiology Queries. I'm Nidhi Kumar and you're watching India Science. As COVID-19 continues to surge across the globe, COVID-related queries are on the go. People are speculating about health problems and cardiology queries today. In this program, where we take your questions from Facebook and YouTube Live, today we are joined by the very well-known, the very eminent Dr. Nitish Naik, Professor, Department of Cardiology at the All India Institute of Medical Sciences, New Delhi. Many thanks for joining us on India Science. Such a pleasure to have you here with us, sir.
Thank you so much.
So, what would be some advice for cardiac patients, especially during this pandemic? We're seeing scores of cases in Delhi as of yesterday.
So, we have been very lucky that how this virus has evolved over the past 2 years. It has become a much milder form of itself, and therefore many of the concerns that were there with the Delta virus are no longer there with the current generation of the virus. And therefore, this is good news for many patients who are previously being treated with a lot of blood thinners and other medications that were required when they were very sick with COVID. That largely is not a concern as of now. This virus has mutated itself into a virus that is more like a flu virus. It generally infects the throat, and at best, it may infect some part of our lungs. But its predilection for involvement of the heart, blood vessels, the brain, and other arteries is much lower, and therefore it is less likely to cause serious cardiac issues in patients who have even got underlying heart conditions. But nevertheless, one should recognize that periods of infections, especially when there are high grade fevers, when patients have got some other comorbidities, it is always wise to continue taking your medications and not avoid or miss them or skip them for some reason. Because sometimes you feel that, oh, I'm running fever, I already need to take these medications. Maybe it's okay if I skip my heart medicines. Maybe it's okay if I skip my blood pressure medicines because my blood pressure has been fine. No, these are periods of stress, and it is all the more important that patients who have got existing heart conditions continue to take their prescribed medicines. Sometimes people feel maybe these drugs may interact with my viral fever and maybe I should not be taking them. So these are common misconceptions. So I would like to reassure people who are hearing this show that if you have got underlying heart disease and you are on some medications, please continue to take them as you were taking before. You did not stop them, add them, substitute them unless your doctor says so. And in majority of the instances, is this just going to be a flu-like illness, you would really not need to do much in addition to what you're taking. But however, if due to the stress of the fevers or some other problems, you feel there are some additional symptoms that come up, you should always consult your physician to advise you further upon your treatment.
So, could you tell us about the condition myocarditis? What does it mean, and
Yes.
how would you like to
See,
explain?
myocarditis is been a problem with this virus because, as we know, this virus does infect some of the receptors that are present in the heart and blood vessels, and therefore it was, and like all other viral fevers, many other viral fevers rather, this virus also affected the heart, and when it affects the heart, it is called myocarditis. Now, in the Delta virus and some of its subsequent generations, we did note a predilection for the heart muscle, and there were reports of people developing myocarditis, and in some patients, the heart function came down as well as a result of the infection. But what I would like to tell is that even in majority of those instances, it was either a very fulminant or severe infection that resulted in these heart myocarditis, or sometimes it was an asymptomatic or even mild myocarditis that subsequently resolved on its own. So currently, in the current generation of this virus, myocarditis has been less frequent. In fact, it has been only rarely reported, and therefore many of the concerns that were there in the previous iteration of this virus are no longer there. But yes, if there are patients who are having unexplained symptoms of breathlessness, if the heart function for some reason has noted to come down in a patient who was previously having normal heart function, or there are other symptoms that come up, then your physician may ask you to get some additional tests done, which may include an echocardiogram. It may include other tests, including a cardiac MRI, but these will be done in a very selected lot of patients and not in all patients.
Right, doctor. We'd also like to ask you and request you to share insights on heart attacks in women. What do you commonly find, and how common is this? Is it more than men? What are the symptoms?
Yes, see, traditionally women are protected from heart problems because of a different hormonal status that they enjoy, and and the female hormones have been shown to protect women against heart diseases. And this protection women enjoy till they achieve menopause, and once the ovarian function comes down, then there is a catch-up phase in during which the heart conditions become more prevalent in women, and after a few years, a couple of decades, in fact, the women are as predisposed to heart problems as they are in men. So that is something we should be cognizant of. But another thing that is very important to understand is that symptoms in women are quite different from that in men. Although heart, it is the same organ, it is the same heart blood vessel, and when there are blockages, you generally expect patients to have chest pain, you expect to have breathlessness, you expect the patient to complain, have pain in even the left arm, classically, or in the neck or shoulder or even the jaw area. But in women, it has been noted that symptoms can be quite different. In fact, sometimes you may overlook these symptoms as some other symptoms, like we always talk about gas problems or something, or sometimes abdominal pain. So symptoms are quite different in women, and because physicians and people generally have the perception that women are protected against heart diseases, so the threshold to diagnose is also sometimes high. So we should recognize that in people who are having especially underlying problems, for example, high cholesterol, high blood pressure, uncontrolled diabetes, they're obese, or they have some other lifestyle issues, for example, they are into smoking or some other consumption of ethanol, or they've got very strong family history of heart disease. In such women, especially when they have symptoms of that, such as breathlessness, fatigue, chest discomfort, these symptoms should be taken more seriously. They have to be assessed by a physician, and rather they be being dismissed by the patient themselves as not as something non-specific. And once a physician assesses them and examines them, then appropriate therapy can be initiated. So regardless, what I would like to say is that regardless of the type of symptoms, these symptoms should be investigated and assessed by a physician, and then he can come to an appropriate conclusion whether these are genuinely due to the heart or they are because of non-cardiac chest pain.
Right, doctor. Thank you so much for that very lucid answer. I now want to ask about blood pressure. Can one have a heart attack with low blood pressure? What is the difference? Or is it only high blood pressure that leads to? There is a lot of, uh, you know, um, um, queries on this.
Yes, see, we should recognize that high blood pressure is one of the most common causes that predisposes people to heart conditions. Blood pressure is often a problem that does not cause much of symptoms, and it is in fact been when you do surveys in people who are above a particular age and you look for blood pressure, you often diagnose people as having high blood pressure, and people are completely unaware that they have such high blood pressures. So blood pressure is a very important predisposing factor for heart disease. In fact, it is sometimes called the silent killer because people fail to recognize that they have any such sort of problem. So high blood pressure is an important predisposing factor to develop heart conditions. But yes, that does not mean to say that people who have got normal pressure or seemingly low blood pressure cannot have heart problems. So it is not an all or none phenomena that if you have normal or low blood pressure, you cannot develop heart condition. Yes, you can. The probability is low, but yes, especially if patients have got other risk factors, then a patient with even normal or low blood pressure can develop heart conditions. But if a person who has developed heart conditions developed low blood pressure, that means the person was not known to have heart problems or blood pressure problems, and when he comes to the emergency or he comes to a hospital setting and is noted to have low blood pressure, then it is often important to understand what are the causes for low blood pressure, because it is important that blood pressure is appropriately treated and recognized and responded to, so that these patients have the best outcomes during their hospital and post hospital stay.
Yes, doctor. We have a question coming up from Shubham from Baroda, and she says one of my aunts is diagnosed with arrhythmia. Can you please explain this disease and also the risk and precautions?
Yes. See, arrhythmias are heart rhythm problems. Heart is a pump that has got pipes that supply blood, and it has got electrical wires that supply electricity. And this electrical supply ensures orderly, progression of the heart rhythm from the upper chambers to the lower chambers. But if there are some disturbances in this electrical setting in the heart, then the disorder that we call arrhythmias comes in. Now, these arrhythmias can be, some of them are very benign arrhythmias, in the sense they are arrhythmias that can be easily treated with medication or with lifestyle measures, or even by simple procedures. Or there are some other more serious arrhythmias in which you need to take some medications. For example, the elderly are sometimes prone to a common arrhythmia, which is one of the most common arrhythmias that we see, is atrial fibrillation. This is an arrhythmia that comes from the upper chambers of the heart. Normally, the upper chambers of the heart function in an orderly manner. They contract first, and that is followed by the lower chambers, which are the ventricles. But if the upper chambers do not contract in an orderly manner, they contract too fast, then what happens is they fail to contribute to the pumping function of the heart. So these patients develop sometimes symptoms of breathlessness, they get fatigue, they may be unable to carry on with their daily activities. This also predisposes them to develop clots in this chamber, and sometimes people can develop strokes, or clots can move to other parts of the body. So it is important that an ECG is performed to understand where this arrhythmia is coming from, and these can be easily treated. Some patients may require medications for brief periods to control the arrhythmias. Some patients may require continuous medications. Some patients may also require medications to prevent clots forming and moving away. So all this is done by a clinical assessment, and majority of these arrhythmias can be very easily treated with simple, easily available medications, and patients can have a near normal quality of life after this therapy.
Absolutely, doctor. Another question that is going on flashing is what is the link between cholesterol and heart disease? And if my body makes its own cholesterol, why does my diet matter? So,
Yes, that is a very important question. This is a controversy that refuses to go away. But we should understand, that cholesterol is a very important part of our diet. It is a very important constituent of our body, and therefore the body does need cholesterol. In fact, without cholesterol, it is impossible to live, and that is why the body makes its own cholesterol as well, to make sure that even when you are not getting enough from the diet, you need to have it in your body. It serves a whole lot of important functions, which would fill up many pages. But at the same time, when you have a lot of excess cholesterol, this is the cholesterol that we find in the blockages. When we look at blocked arteries that have got blockages inside them, we see that this cholesterol is deposited inside these blockages along with some other materials. So obviously, in people who have got a lot of extra cholesterol, this is where the extra cholesterol is going to. And what we have seen is that when you give some medications, some commonly used medications like statins, that help remove this cholesterol, then the patients who have got heart diseases do a lot better. So what this brings us to the fact is that while cholesterol is very important for our normal living, it is also important that it remains in the right levels. And so how do you ensure that your cholesterol is in the right level? Now, one of the key ways is diet. And therefore, although most of the cholesterol is synthesized in the body, one must recognize is that when we have a lot of extra calories, for example, when you eat more than what you can burn, then what happens is that all these extra calories get converted in the body, in the liver, into cholesterol. And this excess cholesterol, when it cannot be deposited elsewhere, goes starts finding a place to hide. And one of the common places it likes to hide is in the blood vessels. And when that's happened, that leads to blockages. So when when the body is making all the cholesterol, is extra cholesterol not important? Yes, it is less important. But remember, in diet, everything is about moderation. You need to have moderate levels of activity, moderate levels of dietary control, moderate levels of exercise. Now, which is why it's not that you cannot stop, that you need to stop taking everything. You can take everything, but you need to take it in moderation. And what would be moderation be? For a person who's doing a lot of physical activity, I'm sure he can have a lot of extra food, a lot of extra calories, because he can burn this food, he can utilize that. But a person who's not doing that amount of work, then you need to be a little careful about how much you're taking in. Yes, do take in that extra amount of food, that extra cookie, that extra bread, that extra pizza, that extra cake, that extra whatever you would like to do. Samosas, kachoris, everything. Do that. But then be cognizant of the fact that when you have taken all these extra calories, you need to burn them away. All the sportsmen, all the weightlifters, all the athletes, they take so much extra food. But that doesn't mean it's unhealthy. It's all good, but then they burn it off. And that's what we need to do in our everyday life. So
Yes, they
nothing is
have
bad.
these. Yes, sir. They have these protein shakes as well. We have an interesting question on our chat right now from Riju Dhanapalan. He says, can good cholesterol help in reducing heart attack? I'd like to add to this. Should I lower my dietary cholesterol or saturated fat? Is that what you're saying, doctor? Is that good cholesterol?
Yes, good cholesterol comes only by exercise. That is the only way that you can push up your good cholesterol. Regular physical activity helps, achieve good cholesterol. And people often have this misconception that really need to do heavy physical work to get to bring up my good cholesterol. No, even moderate levels of activity, but performed for at least 45 minutes to an hour, at least on 5 days a week, is sufficient to raise your good cholesterol. So you really don't need to get crazy about your exercise. You really don't need to start visiting gyms and get an exercise trainer to build up your exercise capacity. Just regular, moderate level of activity. In fact, even running, or you need not run, even brisk activity. Any game. If you're playing any game, whichever you like, that is moderate level of activity, and that is pretty good as long as it is sustained. Swimming, or even, for example, people who like to dance. Dance is a regular form of activity. It is moderate levels of activity, so you can do all these activities that will build up your good cholesterol. And when it comes to the diet, like we said, saturated fats are not bad. Saturated fats are required in our diet, and we just can't eliminate fat. Some people feel that you need to have a complete fat-free diet. That's really not possible, because if you eliminate fats, the only thing that you can substitute fat by now is carbohydrate, and carbohydrates are not any more healthier. So you can't have a diet in which you can eliminate one food product completely. Protein shakes are not going to help build you become any better. You can't sort of substitute a diet with all these supplements. You take a normal healthy diet that's available. You take everything that is required, but in moderation. Now you can't have lots of saturated fats in your diet alone, because that is something that is hard to burn. It contains a lot of calories, and therefore when you have taken all these extra calories, you need to burn them off. So I would say you can have everything, but everything in moderation.
I have one more query, doctor, and I'll add to that. If my cholesterol is less than 200 mg, should I worry about heart disease?
See, heart diseases are not a reflection of any single value. We should not get fixated on numbers. For example, if my blood pressure, like somebody said, is 110 by 70, am I protected from heart diseases? If is my total cholesterol less than 200, am I protected from heart diseases? Is my blood sugars normal? Am I protected from heart diseases? We should recognize that the majority of heart diseases will happen in people who have got mild elevations in all these values. It's not that a person who has got a blood pressure of 240 by 140 will only have heart disease. No, majority of the heart disease will happen in people who have got mild or moderate levels of blood pressure, even in normal blood pressure populations. So what we should need to recognize is that all these ailments are in some way reflected to age, in some way reflected to our lifestyle, in some way reflected to our diet. So many of these restrictions that we talk about, are generally related to a good healthy lifestyle. So in a good healthy lifestyle, you would expect most cholesterol values to be generally less than 200. Blood pressures would be normal, as would be your blood sugar. So yes, if your cholesterol levels are to less than 200, that's pretty good. That's a neat figure to have. That is something that is excellent, and you should be happy about it. But that does not mean that if your cholesterol level is 210, 220, 230, the end of the world has come. No, that's good, and that's good as well. You just need to work upon it to get it a little better.
Absolutely, doctor. Another question again asked by Biju Dhanapalan, and he says, "What should I do if I have risk factors for coronary artery disease?" Could you explain also for the benefit of
Okay.
our viewers, sir?
Yes. See, there are one of the best things about heart diseases is that all the risk factors are modifiable. These are easily modifiable risk factors that we can correct without the need of any medication whatsoever. So what are the factors that predispose to heart disease? There are certain factors which are non-modifiable. For example, your age, your gender. These are some things that come with you, and you can't really change that. Ethnicity. Asians are somehow a little more predisposed to heart disease than other population, but that's who we are. But that does not mean that there's nothing that can be done, because the majority of the factors that cause heart diseases are modified. For example, smoking, right? It's an important cause for heart diseases. This is something that tobacco and smoking and all these other addictions are very important cause for heart disease, and we need to correct them. Lifestyle, obesity, physical activity, blood pressure, blood sugar. All these are easily modifiable, and we can correct them easily, because this requires nothing else but lifestyle modification, and all these factors are within your own control. You do not depend on a physician. You don't need a clinic to help you. You don't need a clinic to do a physical activity. You don't need a physician to advise you on your diet. You don't need a physician to tell you that you should not be smoking or consuming alcohol. So, and your weight is under your control, and you can very well act upon it with everyday homemade measures to control all these factors. So all these risk factors are very modifiable. And one of the best examples to look at it is look at the population that live in rural areas versus urban areas. You would feel that the rural population is somewhat disadvantaged because they don't have access to many of the perks and privileges that we see in urban areas. Maybe they don't have access to the popcorns. Maybe they don't have access to some other fancy foods that you get in restaurants. But if you look at the prevalence of heart disease, it's far lower in the rural areas than urban areas. Why is that? Why is a seemingly underprivileged population doing better? Because they have a far healthier lifestyle. They would be enjoying their day running, playing, being in the fields, doing physical activity, which an urban population is not doing. So clearly, it's the lifestyle that is to blame largely for the difference in heart diseases between urban and rural areas. And this is the best testament to the fact that lifestyle plays the most important role in prevention of heart disease. That does not mean that you cannot cheat, you cannot have ice creams, you cannot have your fancy foods that you want. Please take them, but take them occasionally.
So cheat, but do it very diligently once again. Absolutely. Mr. Manoj Varghese has written to us about angioplasty and or bypass surgery as it's called. Is that the only option, Dr. Naik, for a blockade as suggested by cardiologists these days, or is there some other option, sir?
Well, see, when it is required, angioplasty and surgery are very important for people who have got heart disease. For example, if some people have got blockages in heart arteries and that cause them a lot of disabling angina, they're not able to carry on with their day-to-day work. They cannot carry on with their regular office activity, and sometimes even activities of daily living become limited by the amount of chest pain and breathlessness they have. And when these cannot be, attended to despite medication, clearly angioplasty and surgery are clearly beneficial to this group of people. Similarly, some patients develop suddenly acute onset chest pain, severe chest pain at rest, and they're diagnosed to have heart attacks. Under such circumstances, angioplasty, stenting surgery, or even medical therapy with thrombolytic therapy with the clot busting drugs are very important for treatment of these heart conditions. But do recognize that this is only a minority of patients. Majority of patients have got heart diseases which can be very well treated with medical therapy. And this includes again very common and simple drugs which are easily available in generic form in the market, which can help treat majority of the patients with heart disease. In fact, do recognize that majority of patients with heart disease do not require angioplasty, stenting, or surgery, and most of them will do very well with medication. Remember that even after angioplasty, stenting, or surgery, you still need to take these medications. It's not that if you've got a stent, a surgery, or a angioplasty, now medicines are off. The only thing that prevents recurrences of these symptoms are medications, and therefore medications are the key to treatment. Stenting, surgery only supplement and add to the benefit when required. In certain conditions, it is imperative that these procedures are done, especially when there are acute heart attacks or when this patient is having disabling chest pain or breathlessness. But in the vast majority of people, medical therapy is more than sufficient to take care of them.
Yes, doctor. Another question asked by Manoj Varghese sir is very interesting. He says 24 years back, seeing two blockades, a doctor had recommended immediate surgery for his mother. And but another doctor, when he took a second opinion, perhaps advised regular exercise, diet, and medicine, and it worked. His question is, how do you differentiate between who's telling you what? Because, doctor, it comes to my mind that there have been many queries saying that we've been advised stenting immediately without giving the patient time. Why is this done, and what could be done to remedy these factors, sir?
Yes, I do recognize that patients sometimes get divergent opinions from different people, and that I guess would reflect different viewpoints upon what would the best line of management. But as we discussed, this has been studied by proper clinical trials. The best way to assess the efficacy of any therapy is randomized clinical trials, and one of the largest trials that has been done, and there were a lot of patients that were there from India as well and from our institute, showed that patients who have got blockages, even if it's in two or three arteries, and even there are multiple of them, medical therapy fares as well as angioplasty and stenting, or surgery. So clearly, there is ample evidence to show that people who have got multiple blockages can be treated with medical therapy as well, and they can enjoy the same quality and quantity of life as would be expected by surgery or stenting. Yes, but there will be certain indications when patients would need an angioplasty, stenting, or surgery, and those indications are very well defined. There are very objective ways to assess whether this patient needs surgery or stenting or something like similar, and that is how physicians come to a decision. There may be certain gray areas when you are not very sure, and there may be difference of opinion between two physicians, but generally there are objective ways like doing stress tests or stress imaging, which will help us take these decisions in a more informed manner. But like we just discussed, it is important to realize that stenting or surgery does have an important place to stay in the medical management, but the vast majority of patients, like we just discussed, can be managed with medicines alone.
One last question before we leave, as we're running out of time, doctor. What about diagnosis? If you've realized that you're having these kind of heart symptoms, there are many tests done today to diagnose these heart diseases. Besides blood tests, chest X-rays, you have ECG and Holter test. Is there anything new that has come up that you would like to share with the parents that perhaps records the electrical signals in the heart and monitors whether you need to go in for a
Yes,
surgery?
yes, there is a lot of interest in developing a lot of gadgets that can help diagnose conditions. There are simple gadgets for example, like Holter recorders, extended loop recorders, even wearable devices which help us diagnose certain conditions. Then there are more the high tech gadgets, for example, stress imaging, uh, ca- cardiac cardiac MRIs, and PET imaging, and all these tests are done for a whole lot of difficult conditions which we could not previously diagnose. So imaging has become a very important part of the diagnostic workup of people. Previously, some of these conditions could not be diagnosed, and now with the advent of all these new imaging technologies, we are having a far more, greater understanding of many of these diseases. So, but do recognize that imaging, while it is important, should not be used indiscriminately, because indiscriminate use of these technologies and tools often causes more confusion rather than helping a physician come at a proper decision. So these have to be used in a judicious manner where really indicated, so that the physician is helped by this technology rather than being confused by a test that may not have much meaning.
And on that note, I'd like to thank you, Dr. Nitish Naik, for joining us today and sharing your valuable insights with us. While we have questions still pouring in, I'm afraid we're running out of time and we'll perhaps answer them the next time through. And with this, friends, this is a wrap of this edition of Let's Talk Health. We'll be back with more interesting questions and different episodes. Till then, get vaccinated if you're not already, take the booster, and keep that mask up. On that note, many thanks for watching India Science. Thank you. Namaskar.